welcome back on viewers. I think very important report to speak about obesity and how we can avoid increasing obesity or diabetes or blood pressure in the blood. During our discussion, Dr. Nabeel, you mentioned that we have two types of diabetes. One of them, the first type, if 10% of people are having diabetes from this type, and the second type, 90%. My question to you, what is the difference, the huge difference between the two types, and what about every type, the treatment, why the difference between them?
Okay. From a pharmaceutical point of view,
Yeah.
okay, the difference is the medicine, okay? Because type 1 is insulin dependent. The pancreas cannot produce insulin anymore. Okay, so the blood sugar comes high. Okay, and we cannot treat this type without insulin injection. So this is one difference. The second one is non-insulin dependent. You can use tablets. You can use medicine also to increase maybe the receptors for insulin. Maybe you can increase also or enhance the pancreas increase of insulin. So this is the main difference in the two types.
From your point of view, how it is important, the early diagnosis of diabetes?
Sure. This is what I said before. There is a lot of effort from the pharmaceutical companies, especially MSD, is how to know the family history first, okay, to encourage people to do the test maybe twice a year for blood pressure, for cholesterol, and also for blood sugar, so we can know who is the high risk to be as a member of the family, and plus, of course, doing the part of exercise or a good
physical
lifestyle. Yeah. Okay, it's very important.
It's very important, yeah.
Well, Dr. Nabeel, going back to the methodology of how the drugs work, you said in type 2 diabetes, when the patient is insulin dependent, you give him insulin shots.
Yes.
And then the other
type 1.
Type 1 diabetes.
Okay.
This is when the pancreas cannot produce insulin. So the person is dependent on insulin shots. The other type is, type 2 is the one where he's administered tablets.
Yes.
These tablets are supposed to help the pancreas develop insulin, or?
Yeah, there is different way, okay, for the tablets to work. Sometimes they decrease something to increase something, okay?
Yeah.
Okay, yeah.
Or they increase the receptors for insulin in the cell itself. So it can help,
so it can produce
for more,
more.
Or even the same quantity of insulin will go to more receptor. So this will give more control, okay, for the blood sugar. So it depends on the kind or the group of the medicine for this treatment.
Yeah.
Is there a drug that's specifically supposed to decrease the chance of the CVD incidences in general, and how do they work?
Yes, if you stabilize. If we want to talk now about the cardiovascular events, all the cardiovascular disease or events, okay, we have the high blood pressure, the high cholesterol, and the diabetes. Okay, so if this factors or this disease is normal, okay, some patient has high blood pressure, okay, but it's controlled by drugs. So at the end, we control the whole complications and the whole story of having some cardiac problems. It is the same for cholesterol also, how to maintain the level of cholesterol, and it is also the story for diabetes. Okay. So the control, it is very important. The control maybe can be medicine, and it can be lifestyle, can be exercise, can be whatever. So it is very important to diagnose before, okay, to know before that this is high-risk patient or high-risk person for diabetes or for blood pressure, and try to maintain this. This is the, as I told you, the non-communicable disease. Okay, this is very important, and this is, I think, the program now is it's run. It is start from the GCC Executive Office, and now it runs also through the Ministry of Health.
Yeah, Dr. Nabeel, as a pharmacist, what about the new technology of treatment or medication against diabetes or CVD risk?
Okay. We as an MSD company, we are a mother company, an innovative company. We took the research and development seriously and strongly to serve the patients and to have more possibility for good medicine. It is not only because, as you know, there is a lot of abbreviation that we are the third world or something. But MSD as a company, Saudi Arabia is as important as US after having the drug approved with the US FDA. It can be directly shipped to Saudi Arabia and approved by SFDA here in Saudi Arabia.
Yeah.
Well, that's great to hear. Well, let's go on a report on diabetes and obesity, and then we'll be right back with Dr. Nabeel Naqshbandi continuing our discussion. Stay tuned.
Every 38 seconds, a person dies from heart disease. While it's the #1 cause of death in the United States, certain chronic conditions raise that threat.
Absolutely. Diabetes places a person at about a 2 to 4 times increased risk for cardiovascular disease and strokes.
Sharon Krispinski is a certified diabetes educator. She warns that diabetics should be careful when it comes to their heart.
Well, heart disease is definitely, you're more at risk when you do have diabetes.
February is American Heart Month. The American Heart Association encourages everyone with diabetes to make sure their blood pressure is under control.
The condition of hypertension really accelerates any of the complications of diabetes.
Sharon and the staff at Lee Health Solutions help diabetes patients and their families adopt a plan to reduce their risk of heart trouble.
The dietitians do create a meal plan for them based on their likes, their dislikes, what their carbohydrate requirement is. We talk to them about exercise and developing an exercise program for them that they can actually be compliant with on the long term. We talk about the medications that are specific to them, so we do individualize it.
It's also recommended that those with diabetes see their physician every 3 to 6 months.
So it's very important that people are prescribed medication, lifestyle modification to try to get their blood pressure under better control.
Watching your cholesterol levels is also important. Diabetes tends to lower good cholesterol levels and raise the bad levels, putting these patients at a higher risk of heart disease.
I think very valuable information to all of you today. We discussed in Harmony of Life diabetes and CVD risk and how to avoid, and what about the medications and new technology with Dr. Nabeel Naqshbandi. I think that my colleague Walid have important question to Dr. Nabeel.
It is a very important question, actually, in terms of the, in addition to the medication that a diabetic person may take throughout his life, how important is sports in reducing the incidence of having CVD-related complication?
Okay. It has so many meanings as sport. Sometimes people said that, okay, I have to be...
He doesn't have to climb a mountain or run every day.
Or to be a bodybuilder or whatever. But yeah, it's very important to walk. Okay, there is a lot of says that if you walk for half an hour per day, you will maintain your blood pressure and you will maintain your sugar level. Okay, this is something popular between people. but it is good also to have some jogging and run every now and then, okay, because this also will have a good impact for increasing the HDL in the blood and also maintaining the blood pressure and the diabetes. Sports or exercise is very, very important to avoid such kind of risks from the disease.
We were built that way. I mean, well, not built. We were. I mean, humans are supposed to. They're supposed to hunt for food. They're supposed to. They're supposed to be active, and I truly believe that because of our very, very sedentary lifestyle that we have now, this is the reason why we have so many chronic illnesses that show up in our society. Don't you think, May?
Yes, of course.
But there is a lot of help, if you allow me
sure.
for some seconds. Okay, there is a lot of help from the government now. If you see, especially in Riyadh, we are in Riyadh, there is the, I will call it in Arabic, it's Shara al-Hawamila or whatever.
Yes.
Yeah, it's a very good places to walk.
It is,
okay?
yeah.
And it is not only this one. There is another one around the.
We're having more of these,
Yes.
walkways.
Yeah, walkways and good streets, so you can walk without any problems or any cars or any risk.
My final question, Dr. Nabeel, do you think that our Arabic society or in the Middle East have the enough culture to deal with diabetes or CVD risk? And brief, please.
That's why we need more awareness. Okay, we need more awareness. Okay, I think the responsibility become to the official as MOH officials, and then to the drug companies to help in awareness just to decrease this risk and this dangerous disease.
Yeah.
Well, Dr. Nabeel Naqshbandi from MSD Pharmaceuticals, thank you very much for being with us on the program.
Thank you so much.
Thank you very much. Thank you. It was an honor.
I think our viewers, Walid, we have a report and we'll come back to complete the end of Kamel. Let's see.